Hi there, my name is Christina Diacides. I'm a physical therapist assistant at an outpatient clinic. This talk is going to be about gender-based medicine and how to improve our education, our practices in the clinic. So this is geared towards physical therapists and physical therapy assistants or any other staff who want to join in on the education. So starting off, the difference between sex and gender. Sex refers to the hormonal and anatomical differences between a man and a woman. Gender refers to the differences between a man and a woman, but it's defined by a particular group. So with that being said, there's differences between everyone, man, women, and there's differences between women and women, men and men. Everyone is an individual, but we're going to talk about some differences between men and women. So first off, women, they have a higher ligament laxity. So with that being said, their joints are going to be hypermobile. So there's just going to be a lot more motion. And that's just a tendency. That's not said for every woman, especially depending on where their hormone balance level is. That's where that joint laxity comes into. Women also have a smaller endocondylar notch. This was cool because I did not know this. With a smaller endocondylar notch, it is an increased risk for ACL injury. The endocondylar notch is where the ACL attaches, and there's a risk for injury in men and women. It just depends on the mechanism that they're doing. Because there's a mechanism of injury for an ACL, PCL, all that fun stuff. But due to that smaller notch in women, it's a higher risk factor than men. When women also have a greater proportion of type 1 fibers, which gives you better tissue perfusion and greater capacity for glucose and fatty acid oxidation. So you'll see that with endurance athletes, endurance marathon runners, endurance swimmers. That's going to help them with that longer duration of activity. Men burn through glucose faster, which leads to better short, intense bursts of effort or energy. So that to me is like someone running from one end of the basketball court to the other and then shooting the ball. That fast burst, they're not gonna, basketball games are long, but that short burst of energy is where those type 2 fibers come in, and that's higher in men. Through my research too, I found that men also have higher rates of low back pain, which I thought was interesting, and I definitely am gonna do more research about that to see why. Excuse me. Through this gender-based medicine, I've had the privilege of treating someone who's transgender. She was a man before and was transitioning into a woman. She was going through hormone therapy, and that's really all she told me. She didn't tell me any other procedures or any other treatment she was seeking or sought. I didn't even know until she told me. I was like kind of shocked. I was like, oh wow, well, good for you. And just leaving it open communication for her to talk to me about whatever she needed. She was coming in for low back pain, so I had no idea until she told me. But with her, because of her hormone therapy, she had a lot of psychosocial issues, meaning she had a lot of fear avoidance. She had a lot of anxiety in the clinic and outside of the clinic, and fear avoidance, high anxiety, and then a lot of depression and emotional imbalances, which she expressed to me, and just was noted just to, help her through that and just leave it open for her to communicate whatever she needed and make me aware if I needed to suggest or refer her to anyone else that she needed. And then it was kind of cool to see her there. Through my research, I was reading that most transgender individuals have a hard time getting to PT because of the insurance reimbursement. A lot of procedures or hormone therapies that transgender individuals seek are not covered by insurance. So physical therapy is going to be the last on their list. Also because physical therapy doesn't reimburse for transgender procedures or anything like that. They have to pay out of pocket for all of this stuff. So that's why I'm saying PT is going to be last on the list, because of all the other things that they want to do and achieve, and which makes sense. A lot of individuals have to pay out of pocket, and it's a lot of money, and it's not fun when you're in pain and you're just trying to be happy with who you are. It's a lot. I can't imagine. But due to the lack of insurance reimbursements, a lot of transgender individuals feel discriminated in the healthcare industry. So being aware of that and understanding that and making these individuals feel welcomed and feel like they're going to be cared and provided for is important, because they haven't felt that way. So with that being said, every patient who comes into PT should be treated as an individual. Each plan of care is specific to the individual. So I feel there should not be any negative impacts because of lack of gender-based prevention or therapy. We get the pleasure of treating on how the patient responds. So the patient has low back pain doing squats. We know how to fix that. And then we'll do A, B, and C, see how they respond. And if they don't respond, then we have all the way through the alphabet. Or, just individualizing each plan of care to that individual, which is what each PT company puts themselves on a high pedestal for. And that's what we're taught in school, is to be specific to each individual, which is important. And I feel like that most healthcare providers in the industry should be. You shouldn't just put them in a box and say that's where you're gonna stay. Yes, they're in a box, but they're in a box with all other factors that we see and that we're gonna treat and hopefully improve. Going on that, just providing education, like I was saying before, to your PTs, PTAs, and your staff is going to be important. I was reading this blog that someone put in a rainbow flag for their LGBT community, and how they got such good responses because of that flag. They felt more welcome, they felt accepted, and they felt like they were able to go in and not feel discriminated against, which I think is great. And I feel that's how everyone should feel. Any individual coming into PT should want to feel welcomed. That makes me think of a thing my boss told me, treating each session for each person as if they were coming to Disneyland, and giving that grand experience. Everyone loves Disneyland. Everyone wants to come back to see Disneyland. So that's always kind of stuck with me for any individual. And I think, like I said, most healthcare providers should treat each individual that way. And yeah, the last thing I just want to touch on is, how can you be best prepared for these situations? Is education. Education is so powerful, and continuing to stay up to date on each article, each culture, each individual. I know that there's some terms in the LGBT community that are outdated and now that are offensive. So being aware and being open to learning these things, and providing that communication between your patients is going to be important. But hopefully that gave you some good information. Let me know if you have any other questions. Thank you.